Good afternoon, everybody. Thank you very much for inviting me to speak at your event. My name is Anna Fuhrmann. I'm a pediatrics nurse from Germany, and I'm working with Healthcare Without Harm Europe as a climate officer in Belgium. I am responsible for the Nurses Climate Challenge in Europe, and I'm going to tell you a little bit about that initiative. First of all, I want to tell you a bit about Healthcare Without Harm Europe, the organization where I work at. We are the European arm of Healthcare Without Harm. This is a global movement. We have offices in the US, in the Philippines, a virtual team in Latin America, and partners in Australia, China, India, and South Africa. And we are a membership organization. So we work with 142 organizations only here in Europe, which is partly healthcare providers, so hospitals and health centers, as well as health, environment, and academic organizations. We're not just not just working in the EU, but also in other European countries. The vision of Healthcare Without Harm is to mobilize healthcare and its ethical, economic, and political influence to create an ecologically sustainable, equitable, and healthy world. So to use the Hippocratic oath, first do no harm, that we don't cause any harm with the healthcare we practice. The mission is, though, to transform healthcare so that it reduces its environmental footprint, becomes a community anchor for sustainability, and a leader in the global movement for environmental health and justice. Here in Europe, we work in 4 program areas, which is circular healthcare, which is mainly about procurement, chemicals, and waste. We work on food, mainly the sustainability of food production and consumption, and on pharmaceuticals, mainly about antimicrobial resistance, as well as we're trying to make healthcare climate smart, and that's the program area where I'm working at. First of all, I want to discuss why would nurses even get involved with advocacy against climate change. A big part of that is to understand that climate change is human-made and has a lot of consequences for not only our planet and the environment, but also for us as humans and our health. Since the Industrial Revolution, the use of fossil fuels has driven the emissions of greenhouse gases, which has been heating the planet. And this heat has a lot of effect on human health as well. The impact is not only temperature related, but also a lot more extreme weather events, which causes injuries, illnesses, and also the spread of infectious disease vectors. Here in Europe, that's mainly ticks and also mosquitoes that can transfer disease. The waterborne illnesses have increased a lot, and air pollution has wide-ranging impacts on health. If you haven't read it yet, I recommend reading the Lancet Countdown, which has a very, very good overview on all the health impacts of climate change. Here in Europe, all of the health impacts that I've been talking about are happening, and we're going to have a lot of problems as well with the sea level rise, because many of the European cities are just by the sea, as well as problems with food security and well, droughts and wildfires, which I haven't talked about yet, that are coming even more further north every year. Unfortunately, healthcare is a very energy intensive sector. So we are not entirely innocent when it comes to climate change. Healthcare Without Harm did a report together with Arup, and they found that the healthcare footprint, the climate footprint of healthcare, is about 4.4% of all the global net emissions. This means that if the healthcare sector was a country, it would be the 5th largest emitter in the world. And here in the EU, we account for about 12% of those global emissions in healthcare. Many of those emissions are coming from the supply chain, which is scope 3. And the other scopes would be the energy from heating, cooling, and the emissions produced in the hospital itself. So, for example, anesthetic gases. Here you can see just a few examples of how healthcare contributes to climate change. This can be, for example, the energy that is used for heating, cooling, lighting, water, the anesthetic gases that are wasted, the fleet vehicles, the ambulances, but also the commuting of employees and the transport of patients and visitors. Then obviously a hospital has a lot of food as well for the patients that are there. And the biggest part of the emissions there is meat, which has a huge impact on climate. Then waste is also a big emitter. The landfill gases as well as the treatment of waste can be highly emitting. And then obviously the supply chain. Well, what we want to reach within the climate program of Healthcare Without Harm is we want to have a net zero emissions to stop climate change from happening and from further happening and having less impacts on health from climate change. For that, here in Europe, we work with national governments and health or environmental ministries. And we work directly with hospitals. And last but not least, we involve healthcare professionals in advocacy, mitigation, and resilience building. How do we do that? Well, this is how the Nurses Climate Challenge came into life. The idea of it is to mobilize nurses across Europe to educate health professionals on the health impacts of climate change, as well as providing a free and comprehensive and growing set of resources for them to do so. We're hoping to leverage the unique and trusted voice of nurses, as nurses have been voted almost everywhere in the world as one of the most trusted professions. And people listen to nurses when they talk about health impacts. Additionally, nurses care for patients throughout their lives, so they will see a lot of those health impacts of climate change. This is why they need to understand in their practice how climate change affects human health, and also to see how they, in their work, can help to decrease the impacts of healthcare on the environment. Additionally, if you see the patients daily and a lot of different humans, you can prepare and see which of these patients are at risk. They can do that, for example, by joining or starting some kind of sustainability team in different countries. Those are named differently, but it's helpful to have a transdisciplinary team to work together on making the hospital climate smart. They can aim to reduce the OR energy and the waste. They can definitely educate patients and colleagues and even visitors or their own community. They can choose local sustainable foods and reduce the food waste. They can advocate or also do themselves carpooling, use active travel like biking, walking, or using the public transport. Another big topic is also resilience. It is important to include climate risks in emergency preparedness plans to be prepared if there is some kind of natural disaster, and to be able to react quickly and efficiently. It's important also to reduce waste, to reuse things that can be reused and recycle what can be recycled. And well, as a small addition, you can also plant trees. But well, we have to first reduce before we offset. The overall goals of the Nurses Climate Challenge is to educate health professionals. Our goal until 2023 is 3,500 health professionals. We want to build a cohort of very informed and engaged health professionals across the continent, and launch a movement of health professionals. We have launched the NCC in Europe at the end of January. So in 3 months, we managed to educate 55 healthcare professionals, and we've gained more than 110 nurses climate champions who are hopefully starting to educate more health professionals over time. We also started the nursing school commitment. The nursing school commitment is well, a commitment to include climate change in the healthcare and nursing curriculum, so that not only the nurses already working in healthcare, but also the new nurses, the next generation of nurses, can learn about the health impacts of climate change and what they can do. So we are now having 10 super engaged, amazing nursing schools from all over Europe, from 7 different countries, that are meeting each other or meeting with us for the next few months, and developing this commitment for Europe. We will be publishing the commitment document in September or October in hopefully different languages. And from then on, other universities and schools can join as well. Well, finally, I know you're in South America, so the resources we have are very much well focused on Europe and made for European nurses. But there might be resources that are also useful for you. I think we have a few nurses already who signed up from Latin America or South America. And well, you're welcome to just come to the website, have a look, and register to look at the resources. If you have any questions, obviously, you can always send me a message. I'm happy to answer.